All right, we'll go ahead and get started. Thanks everybody for joining us today for the webinar. Um, I don't know what it means that you're taking time out of your day to learn about HIPAA, but hopefully this is beneficial and worthwhile for you guys. I'm Megan Toombs. I'm the sales manager here at HCP. I also have Josie Henderson on here. She's going to be running the kind of back end with the polls and things like that for the webinar. If you have questions, we do have a Q&A or a chat. I think the chat feature is on. So if you have questions throughout, feel free to chime in on there and we can talk through anything. If I don't have the answer, then I'm happy to get with our team, our compliance team, and answer any questions you may have. So today I really want to spend some time talking about everything regarding HIPAA rules. So how do HIPAA rules get changed and how do expansions happen with rules that already exist? So we'll talk through a little bit of that. We're going to talk about the proposed changes to the HIPAA security rule. That will kind of be the primary focus of this so that you have an understanding of what is being proposed as far as the updates and then how to build an effective compliance program for that. And then we're going to talk a little bit about enforcement. I always get a lot of questions about how do HIPAA audits happen, and then what what are the enforcement penalties if you were to get audited and didn't have in place what you needed. So we'll go over that. And then if you have questions, we'll save some time at the end to go through those as well. So encourage you to participate in the polls if you can. It helps us just get a better understanding, make this more interactive and talk through the things you guys are dealing with. So our first one is going to be, how do you feel about HIPAA? So are you feeling pretty confident about HIPAA, feeling like you have it handled? Maybe somewhat confident, but you're not entirely sure, especially with the new updates. Unsure, you know that there are gaps, not sure where they are, but feeling unsure about it, or completely overwhelmed. It's confusing, changing, don't have it in place, don't know what to do, any of that. And no answer is the wrong answer. I would say 90% of the people I talk to day to day don't have a program in place. So if that's the case with you, don't feel like that's not common. So we'll give that a couple of seconds here, and then once we get the results of that, then we'll kind of move on to talking about how these rules are changed. Perfect. So it looks like we've got majority are somewhat confident, not 100% sure, but feeling okay about it. The next one is pretty confident. So 23% say that they've got it handled, feeling good about it. A couple have some gaps or unsure, and it looks like nobody is completely overwhelmed. So that I'm going to take as a win. So I first want to talk about, I don't know how familiar everybody is with how HIPAA rules are changed. So I wanted to talk about the security rule that everybody is talking about, and then kind of where that stands. And so the way it happens in 5 stages. So the first thing that they'll do is usually because of trends they're seeing, complaints they're getting, audits as they go through an audit practices, they get kind of an understanding of what's happening in real life. So HHS will identify a problem and then they'll draft potential changes to the rules internally. So that's kind of the first step of the process. It's kind of the idea phase. The next, once they've kind of compiled the data and gotten multiple people involved, then they will move to the phase of making it a proposed rule. So what that means is it's published on regulations.gov, and then it's the next step is opening it for a comment period. So it kind of varies based on the type of rule and how big of an overhaul it is, but it's usually about a 30 to 60 day, sometimes longer process for anybody. The providers, associations, vendors, public, anybody can make comments on the rules, complain about them, tell them how silly it is, why it's doable or not. Those kinds of things will be put into consideration. And then They'll review all the comments. Once they close that, they'll review the comments, and then the possible outcomes are what we've seen with that is they'll either modify it to kind of take into account what the comments are saying, sometimes delay it. There are some that actually get kiboshed, so that's a possibility. But they combine all the feedback that they're getting into the final rule is usually how it happens. So once it becomes final, it's officially published in the Federal Register. It has the final requirements, effective date, when it needs to be put in place, compliance deadline, everything that you need to do in order to get that in place in your process. So the current proposed and recent HIPAA related rules, I want to focus obviously today on the HIPAA security rule update, which is heavily on ePHI and cybersecurity. It is an expansion to the rule. The changes are really going to be around enforcing security risk analysis, security controls, enforcing documentation, meaning it's no longer here's our SRA. It's here's our SRA and all the proof of how we are monitoring our systems and making sure that we've got the proper things in place. So we'll talk a little bit more about that. The rule was proposed in January 2025. The comment period just ended earlier this month. And so there's no real prediction on when it will become final, but our team has weighed in a little bit and has talked about possibly the end of this year or beginning of next year when the actual final rule is issued. So I wanted to go into this because I want to make it clear that this is still proposed. The comment period has ended, but we are in that phase of kind of deciding what all is going to be put in place. So the information that we go over today is what is being proposed. It's not finalized just yet. So this is more guidance, giving you an idea of what that will look like. So let's talk about why. So the HIPAA security rule update has come from a lot of different areas, and we've been tracking this over the years, the last few years, but cyber attacks are at an all-time high. That's not news to any of us. There have been record-breaking breaches year after year, ransomware causing major disruptions. You guys saw the Change Healthcare. You probably were affected by it personally and with your practice. So things like that, it's a huge disruptor when we have cyber attacks and phishing scams and all of these things happening. And so as technology improves and as hackers get better at what they're doing, then the regulations have to be updated to keep that in check and make sure that they're enforcing penalties and things like that, so that practices will really put these rules in place or modify or expand them if they haven't already. So the other reason is most weren't doing the basics. We talk about this in almost every webinar or speaking engagement we do. The security risk analysis is something that they'll find time after time that people aren't doing. It was one of those rules that it's required for you to do on an annual basis, and they would find that a lot of practices either didn't know that they needed to do it, or it wouldn't be all inclusive. It was one of those like, oh yeah, we do the SRA and we just do it through our EHR. When I hear people say that, I have to kind of double back and say, what do you mean by that? Like, what is the EHR doing? And then come to find out it's just somebody advertised it that way, saying they do the SRA, and they're not entirely sure what that means. And so we're going to talk about it today. I'm going to get really detailed on what an SRA is so that you can make sure that if you've been misled on thinking that an IT company can come and just do one or two things and that counts, or if you have some type of misconception, then hopefully we can clear some of that up. But there's a lot of things under that, weak access controls, no monitoring, user logs, making sure that username and passwords are updated and users are deleted as they are terminated or moved to a different organization. So the monitoring needs to happen too. And then the other reason is that the existing HIPAA rules were too vague. It's funny because I did a webinar on this earlier this year about policies, the gap between policies and what's happening in real life. And we went into that, how vague the rules were. It's, language like this is addressable. Well, addressable sounds like you can decide whether you're going to do it or not. And that's not what it means. And so they changed, they're proposing changes to that language. So making sure that you know exactly what's required and what is going to be enforced. And then people could, when they would go in to do an audit, they could claim that they were doing compliance, that they had a compliance program, but didn't have all the proof to show what they were doing to make it effective. So those are some of the reasons that it came down. It really is a crackdown on cybersecurity. Which is a good thing. Like, I think that in this world we're living in, none of us want our information shared where it shouldn't be. And so I think that anything that they can do to crack down on that and make it more protected is great. The hard part is when we talk to smaller practices, some of the things that they want done are a little bit outside of the feasibility. So I think that's where you get a lot of the complaints and the issues with it. And so we'll talk about that. Obviously, we exist because smaller practices especially don't have the bandwidth usually to be able to do these kinds of things. And so we come in as a consultant and experts to help you out with that, just so that that's clear from the beginning. So as far as, so I broke this up into 3 different sections, and then want to talk about what's always been required, just make it clear on what was there and then what changed. So as far as risk management goes, I just put a few bullets here, but the requirement has always been to perform a risk analysis. Make sure that you do it on an annual basis, that it's up to date, that if somebody comes in to do an audit, that you've got the record of the SRA, any corrective action you're working on. So that's always been required. So what changed, or what's being expanded, is that it needs to be comprehensive, it needs to be current and documented annually. And so what that means is, and we'll get into the weeds on this a little bit, but instead of saying, we change our passwords every 6 months, it's going to be, here's the proof that we did that. So it's more providing the proof of what you're actually doing with the components underneath the security risk analysis. So we'll talk a little bit more about that. It's always been required to address identified risks, right? And then the expansion is you have to have a written risk management plan with tracked remediation. So what that means is once we identify those risks, a lot of times it's like, okay, yeah, but the policy says we have to update this or monitor this or do this, and we haven't done it in this amount of time. So it's a matter of getting the documentation to show exactly what your risk management plan is, where those vulnerabilities are, and then what you're doing to fix it. So that's kind of the risk management plan. We'll talk a little bit more about that too. Review security measures. So this is like, as you are securing your systems and as you are making sure that everything is done according to the rules, then it's that continuous monitoring and ongoing updates rather than just once a year taking a look at things. That they want you to be consistently reviewing that and updating things as you go. So technical safeguards, it's always been required to implement access controls, meaning like, as you're adding and removing users, making sure that their logins to things are being terminated and things like that. It's the change to that, or the expansion, is just making sure that you have role-based access to things like your EHR or other software systems, and that there are no shared logins. Just so as you do monitor the access log, you can make sure that you've got everybody separated out so you can see who's accessing what. Use authentication safeguards. That's always been a requirement. Now they're really expecting multi-factor authentication, stronger passwords, and those controls will be more enforced. It's been required for you to protect data in transit or storage. So things that you have in filing cabinets or on your hard drive in transit, meaning as it's being communicated to other individuals or vendors. So with that, encryption is going to be expected, especially for email and devices. So that's a huge one. I hear all the time, if we need to email information about a patient, what's the proper way to do that? How do we communicate internally? So those are big questions. And as technology gets better and better, it's always important for us to consider those and make sure that there's encryption so that things aren't being shared that shouldn't be. Maintaining the audit controls, kind of what I talked about already, but actively log and review the system access and activity, just to make sure that if you have, like, we have rules in place on what PHI can be accessed by what individual. So just making sure that that is in line with what the rules are. Implementing safeguards has always been required. This is, again, the testing and validation of the safeguards is going to be required. As far as the administrative safeguards, this is kind of what's happening in the day-to-day. So making sure the workforce is trained on HIPAA security. The changes to that is just that it's going to be required. You'll have either a certificate of completion or something to prove that the training was done for each individual. Having security policies, written policies, has always been required. Now they're going to make sure that it's matching actual operations, that there aren't any gaps in what you're doing in the day-to-day versus what it says in the policy. The respond to incidents, this one is depending on how many individuals are affected by a HIPAA breach or incident. Now they want it to be more formalized, a written incident response plan. So if you do have an incident, that you have a proper way to mitigate it and try to make sure it doesn't happen again. So those are some of those things. Maintaining documentation has always been required, obviously, but this is going to be more of a full audit trail. So what your risks were, identified risks, what you're going to do to fix them, training on, for staff members on what that needs to look like as far as if you're making a major change or if there's something that they need to do in a more, compliant manner, making sure that training goes out on that. And then incidents. So making sure that you have documentation of any type of HIPAA incident, what you did about it, what moving forward, how you're going to try to prevent it. And then a big one is managing vendors and BAAs. This is something that sometimes is a little bit confusing for practices that I meet with. They didn't realize that they had to do more than just sign a BAA or get one in place. So managing vendors, the expansion is going to be verifying a compliance program with the vendors or business associates that you work with. So making sure that they have an appropriate compliance program in place, because if they have a breach on their side as the covered entity, you're still liable for that. And so we, have some guidance and tools and ways to keep track of that, to make sure that the vendors you're working with are HIPAA compliant. And then asset visibility. So this one is this is kind of one of the major changes, is the identifying systems with ePHI and then maintaining a log. So an asset inventory of what ePHI is, what systems you have, where that lives within your organization. So those are kind of what is changing. Time for our second poll. So when is the last time that you did your security risk analysis? Was it within the last year, 1 to 2 years ago, more than 2 years ago, or not sure? And just so you know, again, like the last poll, almost everybody I meet with is either they're in one of two camps. They're like, yeah, we did that, our IT person did it, or we did it in-house, or what is an SRA? So if you're feeling like that, that's where you guys are feeling pretty confident about HIPAA. I don't know that will be our response, but it's good for us to know kind of what we're dealing with. And that way, if I need to go into more detail on the SRA and requirements and stuff, then I can. So I'll give a couple more seconds for that, and then we'll keep going along. Hopefully I'm not boring you guys to tears, because HIPAA compliance can only be so fun to discuss. So I'm sure Teo would chime in if I was boring you to death. She'd be like, come on, tell some jokes.
I absolutely would. But, I find all of this fascinating. So I'm probably the wrong person.
Either you're fascinated by HIPAA or you're cool. No, I'm just kidding. All right, so we've got the results in. Okay, so most have done it within the last year, which that really is good. Some 1 to 2 years ago, which is totally reasonable, and then a few are not sure. So, and that's exactly what I expected. So good to know where you guys are at. Let's talk more about the security risk analysis. And we'll get on or get into, I don't know why that went the other way. Oh, here we go. So I want to talk about with these changes and the updates that we've just talked about, I want to get into some specifics on how you would build an effective HIPAA compliance program with the updated or expanded changes that are coming out. And so the first thing in any effective compliance program, whether it has to do with HIPAA or any other way, is identifying who's in charge. So having a clear documentation to show who is your security officer, privacy officer, whether there's leadership oversight. So sometimes the privacy and security officer can be the same person. Sometimes all of it is the same person. So we see that a lot where you're managing other things, but you're also named as the compliance officer. Our main thing is just make sure that you have somebody that is overseeing it, paying attention, the employees can go to if they have questions. So just assigning that clear ownership is kind of step one there. As far as this is kind of in preparation for the security risk analysis, that person who's overseeing HIPAA really needs to identify where PHI and EPHI live. So I broke them out into the two different ones. So PHI, if you're working on paper records, if you have, this is where you would consider what is being verbalized or spoken within the day-to-day, you know, as you call patients back from the waiting room or as you talk on the phone or things like that. And then through business associates. So vendors and others that you have that are accessing PHI, what kind of agreement do you have in place with them? Are you sure that they have a good compliance program in place so that you're not, you know, in trouble if they have a breach type of thing? And then for EPHI, things like your EHR, email, billing systems, devices. I just put devices, scanner or laptops, tablets, phones, all kinds of little electronic devices these days, scanners and copiers, cloud storage, OneDrive, things like that. And then patient portals is kind of some of those main ones. And there are obviously others, but just to give you an idea. So it's a matter of taking, okay, where does PHI live within our organization? And then, you know, in the World Wide Web, you know, how is that being managed? So then after you've done kind of the preparation, then the next step is going to be to complete the security risk analysis. So perform a documented SRA, and it's going to evaluate the overall risk level when it comes to like your different systems that are containing PHI, the ones we just talked about, any threats and vulnerabilities that you have. So things like what I said, you know, if you have emails with patient information being sent back and forth, that's actually a vulnerability and could, you know, you do have a threat if somebody were to hack into your email, for instance. What your current safeguards are. So what would you do in that instance if somebody did hack in, and what are you doing to prevent it? And then the likelihood and impact. Likelihood and impact is a bigger expanded thing when it comes to that, because it really encompasses a lot of different things, whether it has to do with the EPHI that we're talking about, or things like a natural disaster that takes your systems offline, or, you know, anything like lost or stolen devices, or if somebody got into your office, do you have paper records that are in filing cabinets? Are they locked? Those kinds of things is important to consider when it comes to what's the likelihood of something happening, and then what would be the impact, and then as an extension of that, what would we do? You know, how would that impact us, and then what would we do to fix it? So the SRA is not just a checklist. You have to identify the actual gaps and risks that are there so that you know exactly what to put in place and what exactly is needed. So the next step, I forgot I had a poll question in here. So do you guys have, so I know that a lot of you have done the SRA. Do you have a documented plan to address the identified risks? So let's say you have a policy, I'm just going to keep this basic, but let's say you have a policy that says we change our passwords every 6 months. And then you go and do the SRA and you realize that a lot of the passwords haven't been updated in a lot of time. Do you have a plan or something written down that then addresses whatever that is, whatever the gap is between what's supposed to be happening and what's actually happening? So that's kind of the question. I'll give you guys a few seconds to answer that. It's more out of curiosity, just like, do you have an understanding of what this is? And it's one of the big proposed changes, having a whole risk management plan documented too. So we'll talk about that. All right, so looks like we've got some that have a plan in place, maybe not consistently updated. A few are actively tracking it and have it updated. That's amazing. Some have identified risks but don't have like a formalized plan of writing it down. And then some are not sure. So that's totally what I expected. Where it's not it hasn't been a huge emphasis at this point, it's pretty common not to have it all, written out with a plan in place, but it's becoming something that's going to be, as audits happen, and that making sure that you have an actual identified risk plan, with like a risk management plan is what they're calling it. So my thingy went backwards again. Here we go. Okay, so that's the next step, is to build a written risk management plan. So for every identified risk, we talked about the EPHI, where the PHI lives within your organization. So all of those identified risk areas of how it could potentially be breached. Now we're going to go through and identify, let me move this thing out of the way. We're going to identify several different things. So who is responsible for whatever risk it is that you identified? Who's responsible for making sure that the risk is mitigated or that it's being monitored? What's the issue? So is there the example I used, is there a policy for password changes that actually didn't get followed through with? So something as simple as that. What's the priority level? And that will be based on the impact. If something did happen, how serious would it be? What's the deadline of when you're going to make these changes after you've identified the risk and the missing, the gap between what's written and what's there? And then what's the status? And then obviously corrective action. So you can put this all together into that risk management plan, so that if somebody comes in, let's say the OCR comes in to do an audit, and they're like, you have your security risk analysis and your risk management plan, you can see all of the identified risks, and then you can see the plan to manage that and improve your compliance in that way. So I don't know why this keeps going backwards on me. Maybe I'm clicking on the wrong side of the thing. Hang on. There we go. Okay, so after you have done the SRA, put the risk management plan in place, next step is to make sure that you have written policies and procedures. So I broke down a list here. It's not all inclusive. You may have additional policies required based on the complexity and different customized things for your organization. So the policies and procedures in general, though, should consider security management, risk analysis, making sure that you have a policy in place that says what you're doing for that, access controls and technical safeguards, workforce training, how often you're doing that, sanctions, physical security controls. So what do you have for like passwords to computers to different things? Are you, like the example I used with filing cabinets, making sure that they're being locked or there's a secure area for sensitive information? Business associates, so making sure that you have a clear policy on what you put in place to make sure that business associates are following the same compliance items that you are, making sure that they're securing PHI as it's being transmitted to them. Privacy and patient rights policies, so that's a big deal. And then incident response and breach notification. So depending on how many individuals were affected, what the nature of the incident was, how are we notifying, training, mitigating, making sure that the breach is being handled appropriately. So policies should be updated regularly and when operations change. So this would be anytime you have a new addition as far as like software, a new process that you're putting in place, or really just anything operationally that changes. So the next question here is with I'm curious about BAAs with business associates and vendors. So how would you guys say that you're doing that? Do you verify vendor security regularly? Like, is it something that you ask them about their HIPAA program, or do you just sign the BAA? I think that's the most common from what I've heard. Or do you have BAAs, but you don't actively review vendors, or assume that the vendors handle compliance, or you're not sure? This is one of those things where in the past, I think the recommendation has just been to put the BAA in place with the language that says, as you're working with us, you realize that you need to have a HIPAA program in place, and it outlines a lot of that, but there hasn't been that next step of ensuring compliance. So now I need to throw this out because Taya, as your consultant, she's going to be working with us to become accredited in this. And that's what I always recommend is look for some type of compliance accreditation. Sometimes companies have an easy way to prove it with some type of, seal on their website or things like that. But verifying that is always a good idea. So I'll give you a couple of seconds with that and then we'll move on. That's what I suspected. So 75% have BAAs but don't actively review them, or you assume that they have they're handling compliance internally. So that's what I expected. That expansion of the rule will have you verifying that the BAAs or BAs are working with some type of compliance program that they can prove as well. So as far as that step, in building the effective HIPAA compliance program, it is a matter of identifying every vendor that creates, receives, maintains, or transmits PHI on your behalf. It can be companies like your IT vendor, billing company, cloud storage vendor, shredding services, software vendors, obviously all different types of software. But it's pretty standard to put a business associate agreement in place. I think that's fairly understood. Now it's just a matter of making sure that it's got appropriate language around what is expected as far as the compliance program for HIPAA security, especially, and then making sure that those things are in place. Just as a covered entity, you're responsible for the PHI for your patients. And so it really protects you to make sure that you've got vendors and business associates that are taking the same care with that data. Let's see. So the next thing is implementing technical safeguards. So we talked a little bit about this, but I wanted to get really clear on what that means. What is a technical safeguard? So some examples would be, like I mentioned earlier, unique user accounts for all of your software programs. Make sure there's role-based access. So like in our platform, we have a compliance program. Obviously, not everybody needs to know the background of how compliant the organization is. They may just need to take their training. So we have different roles that we can set up based on who is accessing what. And I would recommend that for any program that you have. Make sure that wherever possible, there's encryption on devices and email, especially. Make sure you're doing data backups, audit logging. So making sure that users that are accessing any system that's being audited, making sure they're not looking at things they're not supposed to, or having weird access. I believe it was the Change Healthcare one that was an internal employee, but a lot of these cybersecurity incidents have happened because of employees logging in to the wrong place and that sort of thing. So making sure that you have a log of that. Again, no shared logins, multi-factor authentication whenever possible, automatic log off of various software programs, making sure when people are logging off their computer that they're signing out. Recovery protection. So if you had your systems go down, how would you recover and have kind of a plan in place? And then patching and antivirus is obviously one as well. Um, and then the next phase is really, so that's kind of the technical side. So this is the physical safeguard side. So make sure that you have your office is locked, that you have, if you have restricted areas, like, like I was talking about, filing cabinets or places that you're storing PHI, make sure that it's restricted, that there's locks, that information can't be accessed. Screen privacy in public facing spaces. I went to take my kids to the dentist a little bit ago, and they had this new office, and it had all this cool stuff because it was a pediatric dentist office. So of course they want to make the dentist look so fun. So they had this huge fish tank, and it was like a big open glass, like awesome fish in there. And I was sitting there with my daughter looking at the fish, and I looked through, and it was the other side of it was their office. And right over on the other side was a computer monitor that was facing the fish tank. So if you weren't looking, then it wouldn't be something that you would see right off the bat. But me being who I am, I was like, that's an example of anybody could look at anything on that computer because it's facing right there, and it wasn't hard to see. So that's, make sure that if you do have public facing, as you in your check-in procedures, or as people are walking by, just make sure that you've got the appropriate safeguards so that they're not seeing information they shouldn't. Secure storage for devices and paper records. So again, filing cabinets that are locked, secure file storage. If you're keeping it internally, making sure you've got passwords to every computer, all that kind of stuff. Controlled visitor access. So if it's somebody who is, we'll get this question, like somebody who's doing something, maybe maintenance or something like that for the practice. They're not accessing PHI, but they're going to be in the office working on something, making sure that they have access to only the areas that they need to, and make sure that if they have anything to do, accessing PHI or any of that, that you're running through the proper, training and things like that, or agreements in place so that you're not held liable if information gets breached. And then proper disposal and media sanitization. So making sure that if you have a laptop that is, let's say you're discontinuing it, or you're getting new ones, making sure that the hard drive is cleared, making sure that any information on that device is not being able to be accessed by anyone else. So, and then make sure that you're disposing of those properly as well, just for that same reason. The next big thing is workforce training. So anybody who has any kind of access to PHI needs to have training on the HIPAA security, privacy policies that you have in place, the process internally in the day-to-day, making sure that you're providing guidance on things like proper check-in procedures, calling patients back, even phone calls, messages. So the training should cover the privacy basics, security awareness, phishing, and social engineering. So what to do if they get a random email from somebody pretending to be the CEO. That's happened to me before, asking me to do them a favor. Password habits, making sure those are getting changed. Make sure that people feel comfortable reporting concerns. I think that's the biggest thing for the culture of compliance internally, is making sure that if somebody does cause an incident or something happens, that they're not feeling like, feeling stupid for doing that. You're happy that they're reporting and talking openly about what happened, because it could happen to anyone. And then PHI handling, obviously, through those things I was talking about, even like phone messages or faxes, or any time that they're handling PHI, making sure they have a really good understanding of their role in that, and then role specific expectations. So if they're handling more PHI, or if they're doing something specific, making sure that their role is very clear and defined on what they need to do. Training needs to happen at hire, so when they start, and then annually thereafter, anytime a policy changes, anytime there's an expansion like this, and then when incidents happen. So if you have a breach or something, it's always a good idea to, as part of the mitigation plan, making sure that the employee or anybody involved goes through and does a training, or maybe even your whole staff goes through and does a refresher training, just to make sure that you're doing what you can to avoid it in the future. The next thing is creating an incident or breach response process. So some of these questions are good things to include. Um, the first thing is, what counts as an incident? And that would be covered in your policies and your training for your employees, so they understand what even counts. What is it? If you send a fax to the wrong person, the wrong number, is that considered a breach? Is there, your email got hacked into? Is that a breach? So some of these are obvious, but kind of defining what that looks like. Who reports it? So if you have a breach, you have somebody who's like, oh yeah, I shared that patient, I sent the bill to the wrong place or whatever. Do they let you know? Do you, like, if the patient calls in and says, I got somebody else's bill, what's the process there? Who's reporting it where? Who does the investigation? So this is going to be that person who's overseeing compliance. The compliance officer is probably going to be the one to define this or do it themselves, but make sure that there's an investigation. How did this happen? Was it just accidentally dialed the wrong number, or was it something that could be fixed internally so it doesn't happen again? How should it be contained? So what if it was your email getting hacked into? What are you going to do? What if they got in and they sent information on your behalf? My first thing would be to panic, but how should it be contained would be, changing passwords, making sure that if somebody did hack in, that they're not able to access it again, and then getting with the person who is overseeing your, either whether you work with an IT company or you have somebody in house, but getting with them on containing the situation depending on what it is. How is it documented? So making sure that there's a whole documentation of what happened, why it happened, what you're doing about it, what you're doing to fix it. And then obviously checking to see if notification is required. So story about this, we had a lady call, this was a while back, I don't even know how long ago now, but she was the practice manager. They had a clinic with, I think it was like under 20 employees. And so they had the practice, and then they had a surgery center where patients would go for the surgery. And so she was kind of the main one that would do this, but she would send the patient record, the kind of what they were doing and what was happening for the surgery, over to the surgery center. And so her email got hacked into, and her password was the only one that was compromised somehow, but it had years worth of emails going back and forth. And so it did affect more than 500 individuals. And she did have to notify HHS, and then had to go through that whole process, like notifying the media, doing the whole mitigation process. So those are just things. I only share that because it's real, and things happen, and you have to kind of be prepared and know what to do about it, because we're human, right? And things happen. So just kind of as a tip, not to improvise the process. If you do have a crisis, make sure that you're following those steps, regardless of what's happening. Testing and monitoring the program is very important too. So it's not static. What we mean by that is it's not like a one and done, like, oh, we did our HIPAA compliance in January, and so we'll look at it next January. It's that ongoing monitoring, especially as issues arise. So checking, and I'll repeat this again, but access logs, failed login attempts. Like if you have somebody who's attempting to log in and it's from a different IP address, for instance, then you kind of know that somebody's trying to. Removing user access as they leave, doing data backups, making sure that you're tracking and aware of vendor issues, vulnerability findings, training completion, incidents, and near misses. So even if there's something that's like, okay, that didn't happen, like I almost did that, document it. Just because if somebody's doing something, chances are somebody else will do it too. And then maybe you can avoid an issue by just, documenting and going through those near misses as well. So security controls should be reviewed and validated, not just assumed, is the goal here. Review patient-facing requirements. So updating, making sure your notice of privacy practices is updated. Your patient rights workflows are up to date and available. Authorization handling. So if you need authorization, what you do to get it, how it's all handled, how it's documented. Access request process. So if somebody needs access to their medical records or needs it shared with another provider, how does that work? And then handling complaints. So just making sure that your employees have a good understanding of how to handle these different things that might come their way. I think this is our final poll. I might have one more for you. I actually think I do have one more for you, but this one is, if you were audited tomorrow, could you provide proof of compliance? And this is kind of a trick question because the rule has been expanded and it's proposed, and so it's not necessarily fully required right now to have everything documented as far as proof, but documentation is super important still. So you kind of know what you're focused on, what your vulnerabilities are, what the plan is if something happens. So I'm just curious to see if you guys have things documented right now, or if they make this rule final, if it's going to be a big undertaking to get all of that documentation available. So I'll give you a couple of seconds to answer that. If we have anybody that says yes confidently, I think that they should get a prize because that's a big deal. It'll be provided by Taya. I just, want,
Absolutely. I would say a
I just,
prize or an audit because that is a hard task.
I just wanted to see if you were paying attention. Okay, so we do have one that said yes. So you guys get a sticker. Mostly, so that's the majority. 60% said mostly, but there might be some gaps. Some said you'd struggle, and some weren't sure. So that's exactly what I expected. As the expansion happens, if you need help with that, it's obviously something that we can help out with our program. We'll talk a little bit about that too, just so you guys know what's available for you as far as our services and how we can help with some of these things. So I want to talk a little bit about audits. I get these questions a lot, so I wanted to include this information just so that you guys know. But the top primary causes of a HIPAA audit come from the first one is business associates or third parties. So those that don't really have a comprehensive program in place to handle HIPAA privacy and security, have a breach usually, and then the breach is investigated with an audit, and then that's kind of usually how that happens. The second most common is random. They just pick a practice and go and do a random audit. It used to be that practices, like I would talk to people that had smaller groups, like, under 20 or under 50 employees, and they're like, we're just small, we're not going to get audited. And gone are those days, unfortunately. So there's a lot of smaller groups that are being audited and checked in on. The quality payment program failure is another one. So that's if they fail to complete something, or if there's improper documentation or something like that, then they'll do an audit on the program to see what's going on there. A lot of them happen because of whistleblowers or complaints. This one's kind of the most common one for I don't know if you guys have heard, we can do a webinar in this too, a whole hour of the right of access initiative, where they're checking to make sure that patient records are being released in a timely manner. That enforcement and that initiative came about because of complaints. They were having so many complaints about not being able to access medical records that they started just going ham and firing, or not firing, but finding everyone on that. And then the fifth one is breach notification. So this is like if you have a breach and it affects a certain number of individuals, and they're going to come and check and make sure that you had proper safeguards in place to prevent it. And then if you don't, then obviously that's a big deal. So I also wanted to outline the violation tiers. And this is always something that I think is kind of entertaining because there's a practice, I'll tell you guys about it. But so the first tier is you did not know of a requirement and you could not have known. So if there was something that happened that you couldn't really predict, you didn't know that you had to do, and you couldn't have known, it's provable that you couldn't have known the requirement, $137 up to 68,928 per violation. So that's the I didn't know what I didn't know. The second one is reasonable cause and not willful neglect. So reasonable cause would be like something happened that was kind of outside of your control. You didn't mean to. It wasn't like you purposefully didn't put something in place so that it would happen. So those are 1379, so $1,379 up to 68,928. Those top amounts are the same for those three. The third one is willful neglect, but corrected within 30 days. So willful neglect is like you have a policy and you've done training. Like I'll see a lot of practices that think that compliance means that they just train their staff on HIPAA and then they're compliant. And those are the ones that usually will get hit with this, because it's like you have a policy that says what you're going to do, and then you trained your staff on what you were going to do, and then nobody did it. And so it's like we can see in here that you knew what to do, and then that didn't happen. So, but if you correct it within 30 days, there's some things that they can take off the table, but the fines are still 13,785 all the way up to 68,928 for that one too. And then this last one, willful neglect and not corrected in 30 days, is 68,000 all the way up to 2 million per violation. There was this practice that was, I can't remember what discipline they were in, but they got a notification of an audit. They just didn't respond, and not within 30 days, and not ever. And I can't remember exactly what the fine was. I'll have to look it up, but it was this major fine just because they were like, nah, I don't really feel like responding to that. I can't imagine having that attitude about it. But if you ever just decide to not deal with the OCR and just not do the audit, then you can plan on paying a couple $1,000,000. So anyway, I always think that's kind of interesting and informative, because it really boils down to, as you are putting these safeguards in place and as you're following the HIPAA security rules and doing this, what are the chances that they're going to come in and make you prove it? And then what happens if you can't? So I just want to make sure that that's clear to everybody as well. And be ready to provide proof of your compliance program. So from here forward, if they, especially if this rule is finalized, auditors are going to ask you to show proof of your security risk analysis, that risk management plan we talked about, your policies, make sure those are written, training logs, your business associate agreements, incident logs, corrective actions, and then asset inventory, especially for EPHI. So those are kind of the things that you'll need to have in place. Make sure that you feel confident about those things. Okay, so then our last poll, and then I'm going to open it up for a few minutes for questions. So what best describes your next step? So are you feeling confident just monitoring the updates? This webinar was more informative to let you know what needs to happen with your program. You may need to review your program. You're feeling like, okay, we kind of really need to look at what we have right now so we know where to go. You need help improving your compliance. And the last one is you're not entirely sure where to start. So this will help, and especially if you guys want. So I think this might be a good time to just talk a little bit about what we're doing with Taya. So Taya has worked with us, partnered with us to do our accreditation program so that she can get her compliance accreditation for her company. And then as a partner of ours, she will be extending a discounted compliance program for her clients. And so this is where this question comes in. If you do need help with compliance, you have our resources and team at your disposal at a discounted rate through that partnership. So if this is helpful, if you guys want our team to reach out to you to schedule an individual call so that we can talk about not just HIPAA compliance, but OSHA, corporate compliance, make sure that you have everything in place as you're working with CMS, or Medicare, Medicaid. We have all the tools and resources to be able to do that. Just so you know, as far as like these rule changes or expansions, our team is staying aware of every update as things happen, especially if the rule becomes final. We update our systems and support and expertise to be able to keep those changes happening in your practice and allowing you to offload it to our team as much as possible. So definitely something that we can do for you as well. All right, I'll give you a couple more seconds on the poll and then we will move on. Looks like most of you need a review, want to take a look at what you have in place, just make sure that it's up to date, which is a really smart idea. And like I said, as you guys are doing that, if you want to get a more formalized program and use our software and support, we're more than happy to get you more information on that, obviously. So I want to open this up. Josie, can I let them talk, or do we just, if they have questions, just type it in the chat?
I think they can just type it in the chat is the only thing.
Okay. Sounds good. Sorry to make you guys work if you have a question, but I just wanted to open it up here for a few minutes and then also give Taya the opportunity if you have anything to say or any questions on behalf of your clients or anything that we can answer.
For sure. I did see one question come in, which was about it. The question is, what about the HIPAA updates related to substance use?
So the HIPAA updates, it was covered in a separate webinar by our compliance team. So I will share that link with you as well. So you can get all of the information on the substance use one as well.
Thank you so much. And
Uh-huh.
I don't know if we can maybe we can repeat it at some point for these guys
Yeah,
here, but
absolutely. Mhm.
I would say my experience going through the accreditation process, I'm a policy nerd, so it's exciting for me, but I've also been impressed at how easy it has been to create all of the policy docs, to push the training out, to monitor the team and their performance with the training. So I have been pleasantly surprised. We've been partners for a very long time. It took me a while to come around to doing the accreditation process, but it has been valuable already, and I'm not even halfway through yet.
I'm glad to hear that. Glad to hear that that's beneficial for you. I think having that oversight and the pointing in the right direction, hand holding is gold. So especially with something like this, if practices most of the time when they're, especially if they're smaller, it's on top of another full-time job. So it's like
Exactly.
impossible to stay up to date, impossible to know what's going on. So yeah, glad to
Yeah.
hear that's working well for you. It looks like I didn't have any other questions come in. Give you guys just a couple more minutes, but I really appreciate you taking the time to join the webinar and go over this information. I will be sharing the link to the recording so you can share that or go back through any of the information. I'll share a copy of the slides as well. So if you wanted to get any of that information about, the effective compliance program or any of that, you can use that. And then if you guys are interested and want to take a look, you want to talk to us individually, here's our contact information. So you can reach out to us or our team can reach out to you to go over we'll schedule a meeting with you individually to go over your requirements and process and then see if there are ways that we can help you.
Thank you so much. I appreciate it.
Yes, thanks, Taya. Thanks for putting this together and let me know if any follow-up questions, if there's anything we can answer or anything we can do to support you or your team.
Thank you so much. I certainly will. I appreciate it.
Have a good afternoon, everyone.
Thanks. Bye-bye.
Bye-bye.